Live, local, late breaking. This is a special presentation of KEZI 9 News.
I have
Coronavirus in Western Oregon.
Activity significantly. It is critically important that we all follow these guidelines to protect ourselves and our neighbors. Literally, it's a matter of saving lives.
Oregon Governor Kate Brown says she is not ready to order the state to shelter in place for now, but it could happen. She says her staff is putting together a list of businesses that are considered critically important that would stay open if she moves forward. For now, she's reminding the elderly and anyone with compromised immunity to keep their distance. Thank you for joining us for the special edition of KEZI 9 News, Coronavirus in Western Oregon. I'm Matt Templeman.
And I'm Renee McCullough. We want to give you the latest numbers. First off, right now there are 88 cases in Oregon, more than 1,300 negative cases, and health officials are still waiting for test results from 437 people.
You can see 18 of those cases are in Linn County. There are 2 cases in Lane County, and Douglas County does have that single case. And we have assembled a team of experts from our area. They have each joined us here tonight, but we are intentionally maintaining social distancing. And instead of having a panel discussion, Dr. Patrick Ludke, who's Lane County's Senior Public Health Officer, who's been providing daily updates.
We also have Dr. Charlotte Ransom, the medical director for the emergency room at Sacred Heart, who can show us firsthand what ERs have been dealing with.
Dr. Karen Weiner, the CEO of Oregon Medical Group, will talk to us about what clinics are experiencing. And
then Dr. Andrea Halliday, the Chief Medical Officer for Peace Health Oregon, is going to talk about how hospitals are responding. All
right, we'll get to our experts in just a moment, but first, the 4J School District says a bus driver is waiting for test results after coming into contact with someone who has coronavirus. They are still waiting for the results. The district sent letters to 240 families of elementary and middle school children who were in contact with him. The driver worked on March 10th and 11th.
It's important to remember that this person has not tested positive for COVID-19 yet. So the children who were around this person are not necessarily considered an exposure.
Now, to be exposed, you have to be within 6 feet of someone who is infected for an hour or more. Parents who have questions can call the Public Health Hotline, 541-682-1380.
Boy, we have taken hundreds of questions from viewers just since yesterday. We want to get to as many of those as we possibly can. We're going to begin with Dr. Patrick Ludke.
Now, let's start with how things are going. It's a basic question, but how are you feeling compared to, I guess, a week or maybe even 2 weeks ago?
Well, feeling pretty well, actually. I think we have a lot of good plans in place to endure what we may endure in the coming weeks that we've been talking about potentially happening. I feel like our system's in place, our people are ready, we're trained, and we're hoping we don't have to use all the skills that we've been training people to, but if we have to, we're ready.
One of the questions I think we've gotten over and over again as we've reached out to people is how many tests are there and why is testing so limited right now?
So currently for Lane County there are 5 possible ways of testing through 5 different laboratories. The main lab that probably everyone knows about is the State Public Health Laboratory. That was the first laboratory to do testing. It has a limited capacity and really focuses on epidemiology and understanding what's going on the ground. The other 4 labs are private sector clinical laboratories, and none of those laboratories have facilities in Lane County, so all those samples are sent out to the main laboratories in other states. So the turnaround time takes a while for those test results to come back.
I'm going to ask you to take just a half step to your right there, but in the meantime, I can ask you a question from Kim. Are they able to get results locally, or do they still have to send all those tests off? And does that apply to all facilities that are testing or just Lane County's health department?
No, currently the actual testing is taking place outside of Lane County. Of course, we're sampling people here in the county at all of the facilities that you mentioned at the top of this story, but those samples, those swabs, do need to be sent away to other laboratories to be tested.
Dr. Ludke, is the county health department right now telling people to stay home for 72 hours? This is a question from Marissa. Or is the incubation period still at 2 weeks?
So I think this is a tough question to answer in a limited period of time. It really depends upon the level of risk in the person. If someone is simply sick, if someone is sick and exposed to someone who was confirmed positive with the test, each of those is different. So in general, it's best to talk to your clinical provider or to call the health department at the number you set up front. That would be very helpful.
We have a question now from Ron. Since most people can't get tested, if a person has all the symptoms, when will they know if they are contagious?
So still circulating in our community are all the usual viruses and bacteria that we see every year during cold and flu season. We still have plenty of people hospitalized with various cold viruses and influenza. And we want people simply to stay home if they are mildly ill. There is little value to being tested and perhaps treated, depending upon the virus. And we think that the best thing to do at this time, if you have mild symptoms, is to stay home. If you have more severe symptoms, call your doctor ahead of time so they can prepare for you and make sure that you expose the fewest number of people possible when you arrive at their clinic.
All right, thank you so much, Dr. Patrick Luckey. Hang tight, we're going to have more questions for you as they do come in the next half hour, but we're going to get to some of our other experts now.
All right, 3 firefighters are still in quarantine after taking a woman to Riverbend who later died.
Originally, 9 firefighters were isolated, but 6 returned to duty. The Eugene Springfield Fire Chief says they've been taking precautions to keep first responders and patients safe. He says they are staffed 24/7 with 16 different fire stations open. He says they do not wear protective gear on every call because they have a limited supply.
All right, Dr. Charlotte Ransom is another one of our medical professionals on the front lines inside the emergency room.
Now we want to start with how things have been these past few weeks. Has it been pretty crazy?
We've actually had decreased numbers of patients in our emergency department over the past couple of weeks, but of course there's a lot of concern and preparation for what might come in the next few weeks.
One woman told us that her sister, and you can just talk to us at this
Okay.
point now, that she told us that her sister had all the symptoms, but she could not get tested. And that's a kind of a common question we're hearing.
Heard that a
Why
lot.
can't people get tested?
Well, as Dr. Ludke alluded to, there's a limited number of tests, and we have had to put parameters in place on who is going to be tested. We have certain types of situations where it's appropriate to test patients. We just don't have enough tests to test everyone.
So Keith wants to know, since there's no specific treatment, why does testing even matter? Would you treat somebody with any other flu or respiratory issue the same way?
In some ways, that answer is yes, but of course we want to know to some degree what the prevalence of this infection is in our community. And when patients are sick enough to be admitted to the hospital, we know that this particular virus can get worse very quickly and people can get very sick very fast. So it's nice to know
What you're dealing with.
exactly.
All right. From Dawn, what exactly are the symptoms? I've heard fever and cough, and these are some of the things that Dr. Ludke talked about. But sore throat, congestion, what else can we be looking for? Should we be looking for, I guess?
Again, as Dr. Ludke alluded to, basically all of those are also symptoms of coronavirus, as well as influenza and common colds and sometimes even allergies. So unfortunately, all of those symptoms can indicate coronavirus or COVID-19. This is why it's really important that just having those symptoms doesn't bring you into the emergency department, that you do only come in when you're feeling ill enough to come to the emergency department, and otherwise you contact your primary care provider or the health department for more advice on what the next best step is.
I wonder if people have many of those symptoms, which are similar to the flu and others, I wonder if that's how the rumors get spread so quickly.
Sure. Well, knowing the symptoms, this is Jewel says she believes she had it 6 or 8 weeks ago. Is there a test to know, like, if you've had it in the past?
There's not.
Okay.
No.
And one of the real quick questions we've gotten flooded with today, really, I don't know why today, but people ask if you get it once, can you get it a second time?
I don't think we know the answer to that yet.
All right.
Okay. Thank you so much.
All right, Douglas County is going to be holding its next drive-through testing clinic, and that is going to happen tomorrow.
They tested 17 people this week who showed symptoms at the Douglas County Fairgrounds. Public Health Officer Bob Dannenhofer says that it's a good way to see multiple people in a short amount of time that's safe for patients and safe for providers. It took about 4 minutes to move a patient through. He says doing several tests in a row also helps conserve valuable high-tech masks that are, of course, in short supply. Now, they started small so they could work out the kinks and see what works and what doesn't.
As you can imagine, hundreds of hours of work went into setting this up, and lots of equipment and lots of other things.
And you do need an order from your doctor to be tested. It takes a few days to get those results back. They're working to get more materials so they can offer more clinics as soon as next week, and most insurance is covering the cost at this point.
All right, let's move along here. Health officials are doing whatever they can to cut down on risks, and one of the things that Oregon Medical Group is doing is providing over the phone care.
That's just the beginning, though, and Dr. Karen Weiner joins us now to talk about some of the other precautions they've been taking.
Hi, yeah, so we started on Monday by looking at our routine operations and changed them significantly to make a more virtual care clinic. And what that meant was repurposing our physicians from seeing lots of patients all through the day to talking to lots of patients all through the day by phone. We wanted to keep healthy people out of our clinics. We wanted to keep minor illnesses out of our clinics. and we wanted to talk with patients who were sick and find out whether they needed to come in and see us or whether they were sick enough to go to the emergency room. We wanted to start outreach to our high-risk patients that have chronic medical conditions to help them stay well through this pandemic. And finally, we just wanted to make sure we were taking care of each other in the clinics.
Now, Dr. Weiner, this is the first day of spring, and we know what that brings soon, if not already. How do the symptoms compare to allergies?
So allergies are itchy, runny, sneezy, and no fevers. If you have a fever, it's not from allergies. A deep cough would be a concern, although coughing can also be an allergy symptoms.
All right, William wants to know, is doing laundry in cold water enough to remove viruses, or should you wash everything in hot water and throw it in the dryer too?
I'm partial to hot water, but I don't know that there's a lot of information around COVID-19 and hot water.
Okay.
From Carol, is there any harm in hot tubbing with or without symptoms?
It's a broad question. I would say that as long as you can maintain 6 feet space between you and your friend, then you can be in the hot tub.
We do not want a packed hot tub right now, that is for sure. All right. Irene says she's very concerned for the population that's been vaping right now.
Yeah, I mean, I am too, and chronic smokers as well. I mean, when you have chronic irritation to your lungs, you're more likely to have problems with respiratory viruses, so I agree.
All right. Also, one more question for you here from George. Can your pets carry the virus?
So I understand there was one story of a dog getting sick, but I don't think that that's sort of a reliable I'm not worried about it.
Okay, perfect. Thank you so much. And stick around. We'll ask you some questions in the next half hour as well. Hospitals and clinics are taking precautions as well to protect patients.
At Peace Health, they are restricting all visitor access at their hospitals in Eugene, Springfield, Cottage Grove, as well as Florence. Now, they do have a few exceptions. People with mobility challenges and those in the ER can have one visitor. Minors, new moms, and end-of-life patients can have 2 visitors.
Dr. Andrea Halliday is the Chief Medical Officer for Peace Health, and you've had to make a lot of very big decisions in the last few weeks. Have people been pretty understanding about all the new restrictions?
Yes, they have been, and they've been tough decisions. It's very hard to limit visitors to people who are sick in the hospital, but we can't emphasize enough how important it is to have social distancing, have people stay home where they can, limit the amount of people that are together at one time. We've got to make sure we flatten the curve so that the hospitals and our medical providers can keep up with the number of cases.
You know, a lot of people, of course, are asking about supplies. How are the closets looking, and does the hospital have enough masks and other needed supplies?
We do right now, but we're concerned about it. We are working on it's called personal protection, and we're working on having a conservation plan for it. And we're also reaching out, actually Lane County is, to dental offices and other offices that are not doing procedures right now to see what we can do to increase our supply in the county.
Nancy wants to know, could you please let people know the importance to not use masks and gloves thinking that they're safe to do so? Because I know we've talked to Dr. Lutke about this before. You wear it, you think you're safe, you think you're protecting others, and really you're not. That's
absolutely right. So if somebody is sick, they should be wearing the mask. It doesn't help for you to wear a mask. And if you wear a mask all day and it gets wet, it's not effective anymore.
All right, from Dawn, we heard this yesterday in one of the stories we saw from overseas. I believe it was maybe France. But can ibuprofen and elderberry, can they make the symptoms actually worse, maybe aggravate the symptoms?
You know, we don't really have enough evidence to say that. There's been anecdotal reports that ibuprofen may not be the thing to take and might make it worse, but we really don't know for sure. Okay. And I really don't know about elderberry. Thank you so much. And again, stick around. We'll check in with you in the next half hour as well. Other hospitals are also taking precautions. Mackenzie Willamette Medical Center in Springfield is closed to visitors with a few exceptions right now. Patients under the age of 17 can have one visitor a day. So can patients who are developmentally disabled or those who are having surgery. Women in labor can have 2 visitors, and all visitors do have to be screened. Mercy Medical Center in Roseburg is closed to visitors. The only exception is compassionate care visits. 1 visitor is allowed for labor and delivery, hospice, pediatric care, as well as companion treatment, surgeries, procedures, and facilitation of care.
And no visitors are being allowed at Bay Area Hospital in Coos Bay. The exceptions are parents of pediatric patients and the partner of somebody giving birth. They will be screened at the main entrance and the ER.
Well, certainly a lot of students might be enjoying this extra time off, but it has been very difficult for others.
It's just a lot of those landmarks in life that you look forward to your senior year that hopefully we'll still be able to do.
How some high school seniors are coping knowing they're missing out on some pretty major milestones.
And we'll hear from two superintendents in Lane County about how they're moving forward with so many major decisions. We'll be right back. Welcome back. While a lot of students, of course, may be enjoying this extra time off, it has been very, very difficult for a lot of others.
All public schools have been shut down until April 28th. The Mr. Eagle pageant at Harrisburg High School is one of the many events on hold. High school seniors from all over the area put on those pageants to raise money for Children's Miracle Network. It's a nonprofit that raises money for children's hospitals and research. It's been hard on these seniors who have worked very hard. Plus, they could miss out on some big milestones like prom and graduation.
I'd like to get to walk across the stage because I don't know if I want to go to college, so it might be my only chance to, you know.
I'm trying to be like the valedictorian, but if we don't graduate, that doesn't work. So also, like, I'm trying to like play baseball in college, and with my senior year not being able to play baseball, it's pretty frustrating.
The OSAA has suspended all practices and contests through April 28th. Well, school districts all over the state are working nonstop trying to figure out what's next, what's going to happen after spring break. Are students going to transition to online learning?
Will the school year be extended? What about graduation? The superintendent of the Bethel School District, Chris Parra, is here to answer some of those questions.
Chris, your office just has to be flooded with questions from parents these days. What do you think the number one thing or the top few things parents want to know?
Well, actually, we haven't been flooded with a tremendous amount of questions. I think that school districts have been working hard to get communication out to families as quickly as it's coming to us. And I think parents are understanding that we don't have all of the answers right now. The number one question is, however, about high school graduation and high school in general.
Can you tell us what your plans are for after spring break? I know that's probably you're still waiting for word from the top, but do you have any ideas yet?
We do. We've been pretty busy this week preparing for staff to return after spring break in a couple of different areas. We have staff who are going to be learning new ways of working together, collaborating, distance, with lots of distance in between them, and getting those enrichment and supplemental materials ready for families. And we also are getting ready to gear up for expanding childcare. We know our first responders are counting on us to provide childcare, and we are going to be expanding those sites. And I think a lot of people think that because we're in the business of educating students that childcare would be a pretty simple pivot, but childcare has a whole different set of guidelines and regulations that schools are not regulated by. So we're learning as fast as we can what we need to do to get those child care centers up and running.
Let's back up a little bit. In terms of the academic requirements, do you think the state's going to be sending down some waivers so kids can graduate on time?
I know that that is definitely on the minds of all superintendents, principals, legislators, and the Oregon Department of Ed, as well as the governor. And so my guess is yes.
All right. So I guess, is there any risk then that kids won't graduate on time? Let's get right to it.
I think that there's a lot of complexities on that. I think what does on time mean, particularly if we're extending school years and things like that. I think there will be some adjustments and likely some prioritization of students. But we also want to make sure that students who have the ability to graduate, that we're also looking at students who may need supplemental or extra support that they would have had during the school year had we been in session.
Right.
So it's a bit complex.
Yeah.
Sorry. What do you say to the students who maybe are feeling kind of anxiety? You know, they're worried about missing school, they're missing their friends, their teachers. It's kind of a tough time for a lot of kids right now.
It is, and there was a sweet story that we had from one of our parents who talked about just that yesterday with one of the principals, that their child was worried about staff and worried about their school, wanting to make sure that everything's okay. And we would say to kids that our staff are fine. We're going to be in contact with them after spring break. We're making personal phone calls home, and we can't wait to see them when they return.
How are you continuing with the mental health support for students and families, and of course all the other health services that come along with it?
So in Bethel School District, we consider our Bethel Health Center to be, as well as our school nurses who have been fielding a lot of questions from our families as well, to be an essential service. And so our health center has remained open. We have a nurse practitioner on site. We also have therapists on site. And then after spring break, we will also have our school counselors who will be making contact with families and being able to provide additional support in a way that we haven't been able to do this week.
All right, well, hopefully we've answered a lot of questions for a lot of folks out there and maybe saved some phone calls and emails to the district, but thank you for your time. We much appreciate it. All right, as you heard from Superintendent Parra, there are more questions than answers for all the school districts out there.
4J certainly no exception. We talked to Superintendent Gustavo Balderas about the challenges he's facing and what answers he has for parents.
Our kids need to be in school. We want our kids in school.
For school administrators like 4J Superintendent Gustavo Balderas, every day brings a new twist and no easy answers.
We have lots of questions.
Balderas says his North Star is following Governor Kate Brown's directives. And that means feeding the district's 17,000 students and keeping its 2,700 staff members on the payroll. It also means coming up with a plan to help kids continue their education.
We will be coming out with a supplemental education plan to relay hopefully this week. That's the goal. What that looks like, we don't know yet.
The district has created 5 leadership teams to work through the daily challenges. As for the school year, the plan for now is to end on schedule in the middle of June.
We may be able to extend out, but we can't extend out too much.
When it comes to academic standards, Balderas says he knows a lot of parents have questions, and he says he's hoping to have answers soon as they get more direction from the State Department of Education.
A lot of questions about what happens with juniors and seniors, especially seniors. Graduation's right around the corner. Those are all unknowns.
So different. You have a senior right now.
I have a senior, yeah, it's tough.
So many people have been filing for unemployment in Oregon this week. It was too much for the website.
Yeah, some advice from the experts. If you still need to file, that's coming up. A little later, we're going to look at the latest plans to pump money into the economy with checks to Americans.
All right, thousands of people have filed for unemployment in the state of Oregon in just the last few days, and the department is asking people to be patient.
Yeah, more than 18,000 people filed claims Tuesday alone, and that's up from 800 on Sunday, the day before the governor issued an order for restaurants to stop serving in their facilities. The unemployment website was offline on Monday, off and on Monday and Tuesday. Officials at WorkSource Lane say that their systems have been overwhelmed since the governor's executive orders that have forced many businesses to close.
The governor has made this emergency thing, which I understand. It's important to keep people safe, but there is no safety net. I would not have been unemployed except for the governor's emergency thing, so why do the people that are affected by that have a waiting week to begin with?
If you're having a tough time filing, continue to call in. You can leave a message. They will call you back. To file online, you do need your Social Security number, your work history over the last 18 months, and your total income from each employer.
Certainly this is having a huge effect on many of the 155,000 Oregonians who work in restaurants and bars. The governor has banned them from serving food in their establishments for 4 weeks, but they can still offer carryout and delivery.
I think more so about the workers. You know, it'd be hard if they can't work and they can't make rent. What happens then?
We're keeping our exposure low and just not putting ourselves in any excessive risk.
Besides ordering food to go, some other ways to keep businesses afloat: order stuff from online stores, buy gift cards, or company merchandise. If you're using cash to do your shopping these days, don't forget to wash your hands. Research shows there is a ton of germs on paper money, including viruses and bacteria, that can live on most surfaces for about 48 hours. Maria Sanchez wants customers to know they're taking every precaution at their taqueria to keep their hands clean.
I just say that they don't have to worry about anything because everything here is clean, it's the same, we prepare the same thing, we wash our hands all day, and I understand that they're very scared about this, but they don't have to.
And she says they do wash their hands after every transaction with money and before touching any food. Health officials say you should also wipe down your debit card and wash your hands after every transaction. The YMCA in Eugene is still keeping their members very close while keeping their distance.
They've closed their doors until April 1st, but their staff is making hundreds of calls a day, checking in on their members, listening to their worries and asking what they need during this uneasy time. One member is feeling down because the Y was their only social connection, and others tell us a simple phone call from the Y is exactly what they need to get them through.
I love what the Y is doing, how they're calling people and they're checking in on their folks to make sure, especially their elderly folks, to make sure that they're okay. I love that they're checking in on us. You know, our kids go to the Y and have that interaction with them. So it was nice to get that call from them and to also know that they're doing what they can to support their folks.
All right, the Y is also filming workout videos for members to access at home on YouTube. The Eugene building is getting a deep cleaning, so it's ready to go when the time comes.
A lot of gyms across the country have closed their doors, and now a former Oregon football player, Javis Lewis, has found an alternative workout method to do right in your home. Lewis is the head trainer for 10 Minute Fix. It's a fitness app that allows people to work out and be active without going to the gym or using any heavy equipment.
I think in the current state of time we're in, it definitely is a safer option just because we are so much in social distancing that it allows you to maintain your health at the convenience of your home. So we have a plan with 10 Minute Fix to continue to make content that is progressively harder but maintains that convenience of 10 minutes.
And another option to get out and about, Wildlife Safari is still open. The park's executive director says their unique setting allows families to stay in their vehicle and enjoy the park. The park is located in Winston, just south of Roseburg.
Well, we've had a lot of people ask about social distancing outside and with family members as well.
And we're going to check in again with our experts for more on that and more of your questions when our special Coronavirus in Western Oregon continues.
Coronavirus in Western Oregon. This is a KEZI 9 News special report.
Oregon Governor Kate Brown says she is not ready to order the state to shelter in place for now, but it could happen. We thank you for joining us for this special edition of KEZI 9 News Coronavirus in Western Oregon. I'm Matt Templeman.
And I'm Renee McCullough. The governor says her staff is putting together a list of businesses that are considered critically important that would stay open if it does happen. Now, for now, she's reminding the elderly and anyone with compromised immunity to keep their distance. The governor also confirmed that a second shipment of personal protective gear from the federal government did arrive, so the state now has about 25% of what it requested.
All right, we are going to check back in with our team of experts. You see now Dr. Patrick Ludke, Dr. Charlotte Ransom, Dr. Karen Weiner, and Dr. Andrea Halliday. But first, the very latest numbers.
Yeah, right now there are 88 cases in Oregon, more than 1,300 negative cases. Health officials are still waiting for test results from 437 people.
You can see 18 of those cases are in Lynn County. There are 2 cases in Lane County, and Douglas County has a single case. Again, back to our questions and Dr. Patrick Ludke. Dr. Ludke, we talked to you just a week ago, I believe, live on our set here. How have things, I guess, so quickly sped up and rapidly changing by the minute? Has any of this really surprised you since a week ago?
It really hasn't surprised us at Lane County Public Health. We've been anticipating this and planning for it. It's fairly similar to the experiences we've seen in other countries and in other states, so it's not really a surprise.
All right.
Can you tell us what is standing in the way of using local research labs for testing like the U of O?
I think it's a really good question. There are plenty of laboratories that could potentially do this work, but doing work with human samples has a lot of extra safety factors built in, and research labs typically don't have those same safety factors built in, and they also have liability issues. You could imagine a research lab that builds a test, and then that test is positive or negative. It turns out it's wrong, and that affects patient care negatively. How do you build in the risk? So that's a tough proposition.
One of the things that I think that we haven't seen enough of, we talk about the people infected. We talk about the number of people that are being monitored. The number of cases that are coming back negative is staggering.
It is quite high, and we really do believe when we're in a situation with limited testing capacity, we have to test those persons who have the most risks up front. So we're working with our provider community, our hospitals, our urgent cares, and our other clinics to make sure we're doing just that, to preserve those limited resources that reside in laboratories.
We had a ton of people ask these questions. How long coronavirus can stay? They want to know about your mail, your letters or packages, newspapers, the bottoms of your socks and shoes, coats, monies, keys, reusable bags, just about everything, Dr. Ludke. Does it stick around on things?
Oh my gosh, this is going to be a long show. So I would say, first of all, that there actually are some studies on other coronaviruses There are 4 main groups of coronavirus. This is a beta coronavirus, and people who have long memories probably remember the other coronaviruses in that class, SARS and MERS are 2 of them. So there have been ongoing studies showing that certainly a large number of our products that can clean things will clean this virus away and kill it as well. And we suspect, and again, we don't have perfect data, we suspect that the length of time that this virus lives on some of those products that you mentioned is similar to SARS and other viruses. So most typically, just a couple days at most. And if you look at mail, well, mail may take several days to reach you. By the time it reaches you, there's no coronavirus on it.
All right. Let's move on. Why aren't daycares being checked for coronavirus? This is a question from Kelly, as are the nursing homes. And if more kids are in daycare, does that put more people at risk there?
So we don't have all the data we would like to have on this virus. We do know that pediatric patients are at much less risk for severe disease. So that is helpful, which means we probably don't need to test them. And they probably are not spreading it as much as adults are. We are in the learning phase here. We have much to learn, and I suspect there will be changes as we go forward.
You know, one thing that our room is full of leaders here, medical leaders in the community. How are you staying positive and keeping all those others that you are communicating with positive? Because that leadership is critical.
Well, I'd have to say in many ways this is nothing new to us. If you just think of the last 5 years, we had a big meningitis outbreak at the university here. We had Zika. We had chikungunya. I mean, we've had lots of different issues. So we're well practiced in this, and we stay positive, first of all, because we're good at it, and secondly, because we're prepared for it.
All right, final question. Can you tell us what a test kit is?
I think that's a great question. It's really confusing to people. Some people think when you say test kit, you mean there's a test right there and you're going to get the results in a few hours. Typically, a test kit is just the swab and the transport media that the virus needs to stay alive until it gets to the laboratory to be testing. So we in public health prefer not to use that phrase. We like to say a specimen collection kit because it's not actually a kit that does the test.
All right, thank you so much. We really appreciate you joining us here tonight. Healthcare workers doing whatever they can to keep at-risk patients separated from others.
Douglas County is going to be holding its next drive-through testing clinic tomorrow at the Douglas County Fairgrounds. Now, they say this is a great way to see multiple people in a short amount of time that's safe for patients and providers. It took about 4 minutes to move a patient through. You do need an order from your doctor to be tested, and then they are working to get more materials so they can offer more clinics as soon as next week. All right, let's get back into the emergency room to see what's being done to keep patients and healthcare workers safe.
Dr. Charlotte Ransom is the medical director at Sacred Heart, and we want to just, how are you handling all the patients? Are you seeing a lot of patients, extra patients right now?
We're actually not. Our volumes are down at the moment. I think part of that is because people are tending to stay home more, but we are preparing for a surge if it comes.
What's the number one obstacle you're facing right now? I've heard it said many times, but are people listening? Stay away if you're not feeling well.
Yeah, I think that's a really great message, and I think that there are a lot of people who are doing that. I think that there are more people who could be doing that. And yeah, our biggest obstacle right now in the hospital is that people would like to be tested, and we just don't have the resources to test everyone who would like to be tested. So hopefully that will change.
Go ahead.
I was just going to say, let's talk about, you can't get into too much detail, but how is your staff doing inside those walls? They are working long hours. They're dealing with a lot of stress, and they have families too. Yeah. So what's it like working with them? And as I asked Dr. Lutke, what's it like keeping the team motivated and pushing, or is that just their nature?
Yeah. It is partially their nature. We have a great team of physicians in our emergency departments. This is what we do. We take care of sick people. So we're not afraid to take care of sick people. Obviously, there is some anxiety over this and what is to come in the next couple of weeks, but I think we have a really great team, and I think we're ready.
All right. Thank you so much for joining us. Sure. 3 firefighters are still in quarantine after taking a woman to Riverbend who then died.
Originally, 9 firefighters were isolated, but 6 returned to duty. Firefighters say they've been taking precautions to keep first responders and patients all safe. They are staffed 24/7 with 16 fire stations open. They don't wear protective gear on every call because they do have, as we've mentioned, a limited supply. All right, we want to get back in with Dr. Andrea Halliday, the Chief Medical Officer for Peace Health, to talk about, again, what is being done to keep all those first responders safe. Doctor.
Well, again, it's a matter of taking precautions, and we're asking if someone has symptoms that the providers wear masks, and there's a special kind of mask that they're asking them to wear if somebody comes in a cardiac arrest into the emergency room. and we're doing everything we can to appropriately use our protection equipment so that we don't run out.
We've heard those, I guess I will say, kind of complaints about these supplies not being allocated out to various hospitals and things like that, emergency responders. Is there any frustration there? How is your staff dealing with things inside where you are?
Our staff has been amazing. Our medical staff, our caregivers, they are stepping up to the plate. They understand that this is what we do. We take care of sick people. And I couldn't say more about them. There's a lot of preparation going on at our major hospital at Riverbend and also at University District so that we will have the capacity to take care of anybody in this community that gets sick.
We obviously heard about the first death in Lane County earlier this week. Is that hard on your staff?
Could you say that again?
We heard about the first death in Lane County earlier this week. How does your staff deal with that?
Oh, well, that's a great question. You know, they took it in stride. We knew it was going to happen. We knew it was just a matter of time, and we've are putting people in quarantine. We've actually changed now that the requirements that if somebody does not have symptoms and they've been exposed, they can come to work and wear a mask. And we're looking forward to the point where we actually have testing more available and can more widely test our healthcare workers.
I think everybody is looking forward to that.
Yeah, very quickly, anything else you want the public to know?
I want the public to know that we are preparing, and so we spend every day, all day, making sure that we are ready in case this ramps up in Lane County. We are meeting with doctors and with our nurses to understand which doctors can do what and how we would make available increased ICU care, increased ED care. And we're actually opening up spaces at University District Hospital to take care of patients so that we can meet the needs of the community. We're ready.
All right, Dr. Halliday, thank you so much for coming in and spending your time with us. We appreciate
that.
Thank you.
Well, it sounds simple, but people really are trying to come to grips with not shaking hands to greet people.
You may remember the scene in Germany when a cautious minister said no thanks to a handshake from Chancellor Angela Merkel. But what about manners and respect? Well, Dr. Lauren Frank, Associate Professor of Communication at PSU, says shaking hands is a social norm and it can be hard to change. So what should you do? She says, try being honest.
Go with verbals pretty strongly and say, hi, how are you, or something like that, and then say, I'm not shaking hands right now, and put our hand down. In some societies, they do a bow, and so we've seen that that's something that some people are picking up right now.
And she says, you can also elbow bump.
We've heard a lot about social distancing, and we're going to check back in with Dr. Karen Weiner to talk about other situations. What about like play dates? And we heard a lot of people asking about playground equipment.
Yeah, it's really hard right now with schools out and children are home. It's spring and it's beautiful outside. I think it is important to get kids outside to play, get fresh air, but we really need to practice social distancing, and that's for the children as well.
Cheryl wants to know, she says, we're grandparents in our 60s. We watch our grandchildren who are 2 and 7. Is that okay?
You know, keeping young children away from grandparents is difficult, but it's probably a good idea. If you can avoid being around young children and you're 65 or older, it's probably the safest thing to be doing right now.
It was interesting. Fees to national parks were waived temporarily. Let's talk about getting outside and taking a walk. Again, that social distancing is still necessary, but it is safe.
It is, and I think it's important to get outside and get fresh air, not only for you know, your physical well-being, but for your mental and emotional well-being as well.
All right, Doctor, thank you so much again for your time and sharing your evening with us. Dr. Karen Weiner, thank you.
Thank you.
Well, not all students are missing out on class in Oregon this week.
How one high school is keeping kids in class from a distance and why administrators say it's been a learning experience for them as well. Welcome back to our special report, Coronavirus in Western Oregon. While a lot of students are enjoying this extra time off, for others it is bittersweet.
Yeah, the governor has shuttered all public schools until April 28th, and for high school seniors, they'll miss out on milestones that many have been looking forward to for months and even years. Things like their senior prom, graduation, or their final season in their spring sport. Kennedy Layton is a multi-sport athlete who runs track for Sheldon High School. She understands we all need to make sacrifices to stay safe, and missing what was supposed to be her first track meet of the season this week has been hard.
I think it's the best for being safe and staying safe, and even though that's frustrating and that means a lot of things are canceled, I think it's best for all of us.
She says athletes have been trying to do stuff on their own to stay motivated, but for now the OSAA has suspended all practices and contests through April 28th. Most students are out of class, but some are still learning.
KEZI 9 News reporter Jacob Roberts shows us how students are learning from a distance at Marist High School in Eugene.
A normally bustling campus, silent. No bells ring between classes, no students walk the halls.
This is an unprecedented situation.
For Marist High School principal Stacy Baker, it's been the ultimate learning experience. Monday was the first day the school implemented what it calls remote learning.
We are running a normal bell schedule that they would be on if they were here at school.
Just like at school, attendance is mandatory, but the kids are at home. The classes are online and the lessons are pre-recorded.
This is going to be the new normal for our students for a while.
We have student council in the morning, then we have school, then sports.
Students say their normally packed school day has been turned upside down. Now they're cooped up at home. It's required them to change the way they think about their day. Students tell me doing their classes online gives them structure in their day, but a keyboard and a screen don't give them the social interaction that they need.
The social aspect of school is definitely taken away, which makes it also like the days feel quite a bit longer.
The technology connectedness is not the same as our regular human connectedness.
Another concern on the minds of staff and students is graduation.
Just graduating on time is like one concern. Having an actual graduation ceremony is another concern.
And I get a little choked up for our kids thinking about that part. I am not sure. I am thinking about lots of different ways that things could be done differently.
But teachers say there's one thing students don't have to worry about changing.
We are still absolutely here for you, and we are ready to respond to you however you need us to respond.
In Eugene, Jacob Roberts, KEZI 9 News.
Now, lawmakers continue to work to find ways to pump money back into the economy. And that could include checks to Americans, how much you could get if the economic rescue plan goes through. Coming up.
The president has given the green light for a relief bill for workers impacted by coronavirus, and now lawmakers are focusing on a $1 trillion plan to help stabilize the economy. The bill the president signed includes provisions for free coronavirus testing and paid emergency leave, and now lawmakers are looking at an economic rescue plan. Senate Majority Leader Mitch McConnell is proposing direct payments of $1,200 per person or $2,400 for couples as early as next month. That plan would also funnel cash to businesses to help keep workers on the job.
And speaking of workers, the number of unemployed is skyrocketing across the nation as service employees are being laid off by the tens of thousands. And here to discuss the local impact is KEZI 9 News anchor China Green, who's joined by Brittany Quick-Warner, CEO of the Eugene Area Chamber of Commerce. China.
Matt, thank you. And Brittany, thank you so much for being here. I know you're extremely busy right now, but we'll get right to it. There's so many job losses right now. What can they do right now?
So a lot of employers are in this awkward place where they're trying to decide, do I lay folks off or not? Obviously, a lot of our food service workers were laid off earlier this week. Employees need to be going on and filing for unemployment. It's temporary unemployment benefits that have triggered a lot of special allowances that the regular unemployment wouldn't. So they just need to go on and apply, and I know it's taking a long time to get through, but they just got to keep doing it.
And federal programs, talk about that. What's available for us here in Oregon?
So the Small Business Administration has a disaster relief loan fund that has to be triggered by our states. The state of Oregon, a bunch of us business partners worked to collect impact stories this week from local businesses. Those have been submitted to the governor. The governor has submitted those to the federal government. We are waiting for our sort of formal go light for that. We're expecting it should be here by tomorrow. So businesses can get on to our local Lane Business Development Center website and they can see where they can apply.
Okay.
Folks should be preparing to do that.
Okay, and then last question, when people do return to work, do they need a doctor's note? We've had a few of those questions come in.
Yeah, we actually got a call from Peace Health today saying if we can encourage employers to not require doctor's notes from these from their employees, they are busy working on all of these other problems around the clock. Employers should lax those requirements and not force people to come with a doctor's note. The doctors have plenty of other things they need to be working on.
Okay, Brittany, and thank you so much for being here. I know we have a lot of work to get back to. Matt and Renee?
Well, a lot of people are coming together to help their neighbors during this coronavirus crisis.
Now, the manager of Laughing Planet is helping to support families who rely on meal assistance programs. They say food is their love language, and that's how they plan to connect with the community. If you need help you can call ahead or just show up. Meals include a burrito or quesadilla, broccoli or corn, and milk or juice.
That's something that aligns with Laughing Planet's core values, and we always are thinking about how can we assist our community regardless of if this was happening or not.
And they plan to continue this active service for as long as the need is there. Well, some taxi drivers in Eugene are also giving back.
Eugene Elite Taxi and Transportation is offering to pick up and deliver groceries and medication to anyone in the Eugene-Springfield area for free. The owner, Jenna Jacober, says that business has slowed, and with extra time and the right resources, she says it's the perfect chance to lend a hand and let people know they're not alone.
We only started about 6 weeks ago, and then this coronavirus hit. So we haven't even had a chance to get started. But the community that was there for us right when we did start have been so wonderful, and we want to be there for them. And I love this community, and anything I can do to give back, I want to give back.
They're offering services Monday, Wednesday, and Friday from 7 to 11 in the morning. She says if demand grows, they'll expand their hours, and you can call 541-600-5577 for help.
The Lane County Diaper Bank wants to make sure parents have the essentials during these uncertain times. They provide diapers to low-income families in the Eugene-Springfield area, and they set up at Emerald Park in Eugene last weekend to hand out diapers.
We are just wanting to come together as a community and support everybody. Right now, times are a little bit hectic and a little bit crazy, and we want to let parents know that we are here for them no matter what.
And if you or anyone you know needs diapers or other supplies, you're going to find a whole lot more information on our website at kezi.com. Again, for all things coronavirus, you can go to our website. We have all of our stories we've done over the last week, and there are a lot of them there, from sports to news to weather. It's all inclusive right there.
And if we didn't get to your questions, certainly email it to us, newsdesk@kezi.com. We'll continue to check in with all the health experts in our area and others to get you the latest information.
And thank you so much for joining us for this special edition of KEZI 9 News. We'll see you soon.